Hi, it's Annie. Welcome back to my channel ANNYFREEDU, where I teach 3D anatomy. With the help of Complete Anatomy by Elsevier, obviously, thank you so much for this opportunity because without them, this wouldn't have been possible at all. Trust me. So, I'm going to teach you all 11 systems such as bones, muscles, cardiovascular system, nervous system, lymphatics, organs, so that this channel and the series of this channel would be for a large audience such as medical and healthcare professionals, as well as medical and fitness enthusiasts. By the way, gamers can benefit from my channel as well because you can understand the 3Dness of human body. This current video that you are watching right now is about terms and terminology in anatomy. Anatomy has a new language. The same way as science has a language, as the law has a language and specific words and terminology. So please understand the fact that when you are learning new subject, first of all, you need to learn the vocabulary. So let's learn vocabulary in this from now on. And the series will be divided into multiple parts. First, this one I will teach you basic terms and terminology, and then I will teach you in the next video aspects and planes. And there will be exercises and quizzes so that you can master 3D anatomy with me. Let's begin.
In order for me to teach you human body, I need to tell you that we divide human body into three parts to teach: regional anatomy, which talks about the regions, parts of the human body such as head, neck, etc. Systemic anatomy that talks about 11 systems, and clinical anatomy that talks about landmarks on a surface area so that we can examine and do and perform surgical procedures safely and precisely. But don't get confused. We don't teach first regional anatomy and then systemic anatomy and then clinical anatomy. We do them at the same time. For example, if I teach you abdominal region, I need to teach you what are the blood supply and blood drainage, digestive system, endocrine, integumentary, which means hair, skin, nails, etc., lymphatics, musculature system, what are the nerves in the abdominal region, reproductive system, respiratory if there is any, and skeletal and urinary systems in the abdominal region. And when I do this all systemic anatomy, then I go to the clinical anatomy and I teach you. For example, if a patient comes to the clinic with the abdominal pain, maybe in specific area, right? We need to know what lies behind that pain point. And if we need to do some surgical procedures, then we do need to know that in order to get into the damaged, for example, appendix, what are the structures that I need to go through in order to reach this appendix safely and not damaging major structures, nerves, blood vessels. Otherwise, we might have a bleeding there. Now, let me teach you very important anatomical terminology that we call that anatomical position. Why we need this? First of all, because when we describe a patient, it's the patient's right side, the left side, maybe upper part, maybe lower part of a patient, we use this anatomical position to imagine, all right? So in 99%, we use this anatomical position to describe a patient and to produce anatomical terminologies, but this 1% that I will teach you later on, we use not anatomical position. I will tell you later which position we are using. So let's begin. Now let's describe what is anatomical position with 8 criteria. If you are a 10-year-old person, what you see first thing is that this body is not sitting, is not lying on a bed or anywhere, it is standing upright. And that's our first criteria for the anatomical position, standing upright. So when we imagine our patient, to describe a patient, its rightness, leftness, etc., we imagine this patient in a standing upright situation. The next thing that comes to your mind when you observe this diagram is that head is facing forward because we are standing forward to this body, as well as eyes need to face to us. If we are standing in front, then the eyes are looking forward. Also, palms are facing forward and toes are facing forward as well. So here you have other four criterias. Head, eyes, palms, and toes are facing forward. Actually, we call this part of a body a trunk, like a tree has a trunk, and tree has branches. Upper limbs or lower limbs are the branches of a trunk. Anyways, we can also see that arms are side to the trunk. That's another criteria. We can also see that legs, lower limbs, are close to each other, but they are not very, very close to each other. So we have a gap between each other. That's another criteria, the seventh one. And also, we need to fairly mention that the feet are parallel to each other. That's it. That's 8 criteria of anatomical position. And every time we are discussing and every time we are describing a body or a patient, we use this so that if we are two doctors, you are from one part of the world and I am from the another part of the world, and we communicate through a phone, you still can describe and tell me that, oh, pain is in the abdominal region on the right side, and I exactly know which part you are talking about. Before we proceed, I need to tell you why we use palms facing forward and not back part of a hand to face forward in anatomical position. For that, I need to tell you that upper limbs are divided into 3 parts: arm, forearm. Prefix for is the similar as front. That's why we call this part of a head forehead, which represents front part of a head. And the forearm continues into a hand, which has 2 surfaces: palm surface and back surface. One more time, I'm explaining why we use palms to face us in anatomical position. Okay? And I also need to explain the fact that forearm can be placed in a space in 3 basic positions. Please take one of your forearm in a way that your palm is facing upwards, superiorly. Superiorly means higher, above. Superior person means somebody in a hierarchy that is standing above you, right? That motion we call supination, and in this case, forearm is supinated. This is how we describe. If you change the position of your forearm and you place your palm downwards to the floor so that your palm is facing downwards, we call that motion pronation, and we say that forearm is pronated. And we also have third position, we call that neutral position. You can take both of your arms and face both of your right and left palms to each other, and that will be your neutral position. Additional information that I want you to understand is that in arm region, we are having this one singular bone we call humerus. In the forearm region, we have 2 bones, such as radius and ulna. This is an X-ray of a right upper limb. So this will be arm, and these 2 bones are in a region of forearm. Here we have radius and we have ulna. In supine position, when the palm is facing upward, these 2 bones are parallel. But in the prone position, radius and ulna, they crisscross each other. So radius crosses over the ulna, and ulna also changes the position, and it creates more complex relation. We don't want that complex relation. in anatomical position. So that's why we are choosing a palm which represents supination, and we don't use a palm that presents pronation, because in pronation, radius and ulna, these two bones, crisscross each other, but in supine position of a forearm, these two bones are parallel. So it's easier to describe later on, and you will understand even better. I will repeat this topic multiple times. So this is a diagram, and it tells us that here we have supination, where the two bones are parallel with each other, and in pronation, where these two bones crisscross each other. In a medical practice, we are having other positions as well, but for now, let's use the words and phrases and terminology that we know so far. If a patient is horizontal and facing upwards, we call that supine position. If a patient is lying horizontal and facing downwards, we call that prone position. The word lateral literally means the side. So we have two sides, right and left. So we call that, for example, right lateral position or left lateral position. We have two sides, right side and left side, right? So we can say that patient is positioned in right lateral position or left lateral position. Other positions that we are having here is not relevant for the scope of this video, so ignore them for now.
Whew, did you understand everything? Was there anything that you didn't understand? Please write down your comments in the comment section so I can use them as a reference in the future videos. So maybe you understand the topic so much that you want to go into more deeply and understand even more. Or maybe I didn't show something that was necessary for your understanding or for your logic to understand. Thank you so much. Follow my social media, TikTok, Instagram, Facebook, Telegram, WhatsApp. I will share my videos there as well if you ask me to. So I will see you in the next one. Thank you so much.